Now let us begin with the updates and developments regarding COVID-19 from India in Ground Zero. We'll be taking stock of the data first. Let us take a look at the latest data regarding spread of coronavirus in India. The total number of active cases of COVID-19 in India has risen to 553, while the total number of positive cases in India is 606. 10 deaths, casualties have been reported due to coronavirus in the country. 43 people undergoing treatment have been cured. They've been discharged. It's a note of optimism from the hospitals. The highest number of cases have been reported from two states, Maharashtra and Kerala. 128 positive cases in Maharashtra, while 109 cases in Kerala. So that's how the data stands as of now in the country. Prime Minister Narendra Modi had a video conference interaction with people of Varanasi today. At his first public engagement after announcement of a countrywide lockdown, Prime Minister said government has formed a help desk in collaboration with WhatsApp to seek correct information about coronavirus.
कोरोना से संक्रमित दुनिया में 1 लाख से अधिक लोग ठीक भी हो चुके हैं और भारत में भी दर्जनों लोग कोरोना के शिकंजे से बाहर निकले हैं। कल तो एक खबर मैं देख रहा था कि इटली में 90 वर्ष में से भी ज्यादा आयु की माताजी भी स्वस्थ हुई है। वैसे मैं आपको ये भी जानकारी देना चाहता हूं कि कोरोना से जुड़ी सही और सटीक जानकारी के लिए सरकार ने व्हाट्सएप के साथ मिलकर एक हेल्प डेस्क भी बनाई है।
In his address, Prime Minister Modi also appealed to people to take pledge to take care of at least 9 poor families for the next 21 days. It will be a true Navratris. He said that due to the lockdown, animals are also facing trouble and people should take care of animals around them as well.
ये नवरात्रि का जब प्रारंभ हुआ है तब अगले 21 दिन तक प्रतिदिन 9 गरीब परिवारों की मदद करने का प्रण लें। 21 दिन तक 9 परिवारों को आप संभालें। मैं मानता हूं अगर इतना भी हम कर ले तो मां की इससे बड़ी आराधना क्या हो सकती है। ये सच्चा और पक्का नवरात्र हो जाएगा। इसके अलावा आपके आसपास जो पशु है उनकी भी चिंता करनी है। लॉकडाउन की वजह से अनेक पशुओं के सामने, जानवरों के सामने भी भोजन का संकट आ गया है। मेरी लोगों से प्रार्थना है कि अपने आसपास के पशुओं का भी ध्यान रखें।
Union Cabinet, chaired by Prime Minister Narendra Modi, met today in New Delhi. Briefing the media persons after the meet, Union Minister Prakash Javadekar stressed that the decision to impose 21 days lockdown by Prime Minister is the best possible way to tackle the ever-present danger posed by COVID-19.
I am very sure that because of the lockdown announced by Prime Minister and followed by people of India, definitely it will have a very positive impact. And only through this common action, joint action, stay at home, keep social distancing, wash your hands regularly, and if you find any symptom, immediately visit doctor.
And the government is laying emphasis on social distancing as a tool to combat the outbreak of COVID-19. Joint Secretary in the Ministry of Health, Love Agarwal, spoke about the measures taken by the government to enforce social distancing norms and advising people to stay at home.
ग्रुप ऑफ मिनिस्टर्स के लेवल पर भी एक डिटेल मीटिंग हुई थी। सारे माननीय मंत्रियों ने इसके ऊपर कोविड-19 की प्रेजेंट सिचुएशन के ऊपर समीक्षा करते हुए ये कहा है कि जितने भी आदेश जारी किए गए हैं उनको पूर्णतः अमल किया जाए। सोशल डिस्टेंसिंग एज ए पॉलिसी मेजर क्योंकि हमें इस बीमारी का ट्रांसमिशन रोकना है। उसके तहत जो भी कार्रवाई की जाए उसके ऊपर हर स्टेट, हर डिस्ट्रिक्ट में 100% पूर्णतः अमल हो, उसके लिए उन्होंने आदेश जारी किए हैं। साथ ही उन्होंने ये भी कहा है कि कई लोगों को, जिनको जो विदेशों से आए हैं पिछले कुछ दिनों में, और वो लोग होम क्वारंटाइन सजेस्ट किए गए हैं, तो सब लोगों को बचाने के लिए ज़रूरी है कि वो जो होम क्वारंटाइन की गाइडलाइंस का पूर्णतः पालन करें। और ऐसे में अगर हमें पाया गया कि अगर वो उन गाइडलाइंस का पालन नहीं कर रहे हैं, होम क्वारंटाइन की गाइडलाइन देते हुए भी इधर से उधर ट्रैवल कर रहे हैं, तो वो इन्फेक्शियस डिजीज़ का रिस्क बढ़ाते हैं, तो उसके लिए भी उनके ऊपर अंडर द एक्ट कठिन से कठिन चर्या की जाएगी।
Meanwhile, the updation of National Population Register and the first phase of Census 2021 have been postponed due to the 21-day lockdown announced by Prime Minister Narendra Modi. Both the exercises were supposed to be carried out from April 1st to September 30th. These exercises are postponed until further orders. The supply of essential goods is normal in different states and union territories. In the times of the lockdown, shops of essential goods, including milk, have been open and people have been buying things that they need. In fact, we'll get you some visuals as well of different places from across the country. These visuals came in from Delhi. The visuals came in from Delhi. People were asked to stay at home, and there were also queues seen outside of places of essential goods, and people were going about their lives in a controlled fashion. Milk and other goods were all available. These visuals came in from Delhi. And we'll also get visuals from the other parts of the country. Sanitation activities have been on as well in the national capital. And next we are looking at visuals from Jammu and Amritsar. And as we said, essential commodities, essential activities have been on. However, non-essential shops and institutions have been shut. Milk and other goods have been available. These visuals came in from Amritsar, and people went about their daily life collecting essential commodities from their neighborhood shops. But as I mentioned, the non-essential shops and institutions were shut, and there was also high security at different places. In Jammu as well, we could see the temples and other religious places were shut as per the direction, complete lockdown in the country. Only institutions that are engaged in essential services or essential goods are open. Temples in Jammu, in those visuals, all shut. Only priests have been allowed to be in the temple. People have been asked to stay at home. Now, with the nationwide lockdown for 21 days, Meghalaya also braces up to fight against coronavirus. The state government and citizens are taking every effort to curb the spread of coronavirus. Here's a ground report by our correspondent Gautam Kumar from Shillong.
With Prime Minister Narendra Modi announcing a nationwide lockdown for 21 days, states around the country have followed suit by intensifying their measures against COVID-19. Here in Meghalaya, the Chief Minister has promulgated a curfew wherein everything is off the road. As you can see, the streets of Meghalaya bear a deserted look with no people or vehicles. Shops are shut, barring the exception of few essentials like pharmacies. The curfew in Meghalaya is so extensive that even shops selling essential commodities like milk, bread, or rice are shut today. However, the government has ensured that essential commodities will be delivered at your doors starting from tomorrow. I'm here standing in front of a pharmacy, which is one of the only shops open throughout Meghalaya. How do you feel about the measures taken by both the Prime Minister and the Chief Minister?
I think that's our only option left for as of now. And the only advice to all people is kindly stay at home, be safe, protect your family and save yourselves.
And as a resident of Meghalaya, you're in full support of all the measures that are taken?
Yeah, that is the only way of heading towards it.
With the grit and determination showed by the people in the state and the guidance and leadership of both the state and the center, there can be no doubts about who will win this battle between COVID-19 and the people of the country.
And our correspondent Girish Nishana spoke to people in Delhi to know about their reaction to the lockdown. Overall, people were satisfied, happy at the lockdown for the reasons that it has been enforced, and expressed satisfaction the fact that all essential commodities are available.
इंश्योर कर रहे हैं कि किसी को भी नकदी की कोई भी प्रॉब्लम ना हो। तो जब तक शाखा ओपन होती है सभी लोग शाखा के माध्यम से अपना लेन देन करते हैं। उसके बाद हमारे यहाँ देखेंगे कि हमारे एटीएम के अंदर 2 मशीन लगी हैं। ये मशीन 2 प्रकार की, इसको एटीएम कहते हैं, दूसरे वाले मशीन को हम बीएनए कहते हैं, बंच नोट एक्सेप्टर। बीएनए का काम क्या होता है कि जब आप इसमें जैसे बैंक के टेलर में अपने जो पैसे जमा करते हैं उसी तरह से आप बीएनए के माध्यम से भी अपने पैसे को जमा कर सकते हैं। साथ ही साथ अपने एटीएम के द्वारा आप उस पैसे को निकाल भी सकते हैं। तो जो एटीएम और बीएनए 24 घंटे हमारा बैंक और हम इंश्योर कर रहे हैं कि इस लॉकडाउन में किसी तरह से ग्राहक को किसी तरह की कोई भी परेशानी ना हो।
दुकान में सामान सारा मिल रहा है। दूसरी बात, प्रॉपर तरीके से मिल रहा है, जो भी चाहिए आपको रेट टू रेट मिल रहा है, कोई ज़्यादा नहीं है, कोई काला बाजारी नहीं है, कहीं कुछ नहीं है।
सामान की कोई कमी नहीं है, सामान पूरी तरह है, पूरे पर्याप्त मात्रा में है, सामान की कोई कमी नहीं है।
कोई मेडिसिन की कोई इशू नहीं है, कोई शॉर्टेज नहीं है। सप्लाई में थोड़ा डिले हो सकता है पर मेडिसिन की कोई शॉर्टेज नहीं है। हम तो पेशेंट्स को खुद बोलते हैं आप व्हाट्सएप करिए, मेडिसिन हम निकाल के रखेंगे, आप आइए और लेके जाइए।
Now, amidst the challenge posed by coronavirus, reports of inspiring initiatives are also emerging. COVID-19, good news. Now, during the cabinet meeting that we mentioned earlier, Prime Minister Narendra Modi and his colleagues led by example in fight against coronavirus. The large oval table in the hall was gone and Prime Minister Narendra Modi and his ministerial colleagues sat in chairs, kept at distance from each other as they practiced social distancing to combat coronavirus. It wasn't just the Prime Minister and the cabinet, people too in Gujarat, for instance, are following social distancing amid the lockdown. Some videos have been shared on social media to show how everyone can engage in social distancing. You can see those marks on the floor in the visuals, how people have marked places to stand at a distance from each other while they go about at shops and ATMs to procure essential commodities. Let's move forward in the show. We now take stock of the impact of coronavirus across the globe in COVID-19 World Wrap. Now, let us first look at how widely has coronavirus spread across the world and the worst impacted countries. We'll just look at the data now. The total confirmed cases as of today stands at 3,72,757 across the world, and total deaths are over 16,200 deaths have been reported. These are figures, WHO figures given out by them, the most authentic source. So that's the figure as it stands. What about the countries affected? Are we looking at countries first affected vis-a-vis the number of deaths? Italy is at the top, over 6,000 deaths. China, the original epicenter, has highest number of confirmed cases, but the number of deaths have been controlled in China, over 81,000 cases in China. Number of deaths are over 3,200. Next comes Spain as far as number of deaths are concerned, 33,000 cases and over 2,100 deaths, followed by France. So we see a lot of European countries in the top nations affected by coronavirus. Germany has 29,200 and over that cases, 126 deaths only. Iran in the Middle East is also impacted, 23,000 cases nearly and over 1,800 deaths have been reported. America is in fact said to be the next emerging epicenter after Italy with 42,164 cases and increasing. The deaths, however, reported are standing at the moment at 471. The White House and the US and Senate leaders of both parties have struck an agreement on a sweeping $2 trillion measure to aid workers, businesses and healthcare systems strained by the rapidly spreading coronavirus. The agreement came on late Tuesday after days of often intense haggling and mounting pressure and still needed to be finalized in the detailed legislative language. Unprecedented economic rescue package would give direct payments to most Americans, expand unemployment benefits, and provide about $367 billion program for small businesses to keep making payroll while workers are forced to stay at home. Some updates from the other countries as well. With the whole of French Riviera now living under coronavirus lockdown, confinement is increasingly becoming the new normal, with empty streets and increased police control. Now the Cannes Film Festival venue is opening its door to town's homeless who have nowhere to go during the coronavirus lockdown. Officials in Cannes are providing 82 beds a day, night meals, showers, as well as books, games and television. And white-suited medical staff wearing face protectors, masks and gloves hovered around beds of coronavirus patients in the intensive care units of one of Rome's newly adapted clinics in the country's fight against the virus. The Casal Palocco Hospital, or COVID-3 as it is known, has recently been turned over for exclusive treatment of virus-infected people. Meanwhile, Argentina's army has built a quarantine hospital on the field to treat an uptake in coronavirus cases. With the country in lockdown to stop the spread of pandemic, the hospital has 28 beds and state-of-the-art equipment such as respirators and X-rays. President Alberto Fernandez has ordered a national quarantine to be put in place until March 31st. Now, 40-year-old Daniel Schumack is recovering from coronavirus in Northwick Park Hospital in London, presenting all symptoms of the deadly coronavirus. His wife called the ambulance service. Within a day, Daniel started to hallucinate with high fever. He was rushed to hospital for treatment. His wife shared the message on social media, requesting people to respect quarantine, stay at home and stay safe.
I just want to keep spreading the message, even if you're young, fit, healthy. You know, it can hit anyone. We have no idea why Danny reacted the way he did. But just stay indoors and please, please stay well.
And time now for a tip from medical experts in Doctor Speak. Dr. Rajiv Mehta of Sir Gangaram Hospital in Delhi advised that given people should take the nationwide lockdown in the right spirit, try to engage in creative and routine activities at home and try not to be anxious about staying at home during this period.
The worries and apprehensions regarding the coronavirus or their hypochondrosis can be solved by calling the helpline number, discussing their symptoms and to know whether it is really a coronavirus or not, and believe them. Believe the health agencies that they are telling the right. They are not just befooling you to postpone the things. People generally say कि मेरे को तो ये करना नहीं चाहते इसलिए ऐसा कह रहे हैं. The health authorities are not like that. They are very particular. They need to diagnose each and every case of coronavirus. So ring the helpline number and you will come to know whether you are really suffering or not. That is the one impact. That is the one solution. The other solution for those who have been housebound. Don't get a monotonous life. Prepare a routine. Maybe a different routine for different day.
And some tips now and insights that you can use in your safety in your hands segment. Now, understanding the importance of social distancing, how does coronavirus chain works, we will understand now through this very special illustration. Do stay with me and understand what it is. Now, we have four groups of people, A, B and C, D. We've color-coded them. We'll see how they are reacting to coronavirus. The first is the carrier of coronavirus, infected person. Most easy to find. They mostly are being treated in hospitals or have been cured already. Now, A goes out to find a person. C, passerby, stranger. B, in public. A and B don't know each other. A is looking for C, remember. A and B meet at airport, bus stations and other places. Now, A arrives and no matter how many C, the person that they're looking for, we can always find them. These are usually family, friends, colleagues, neighbor, cashiers, cinema hall counter staff. So A is being treated and C, it's easy to quarantine through location finding. It's easier to find. Now, there is a fourth section of persons, D, who are staying at home and are quarantined. The problem is we can't find B, who A did not want to meet, had just crossed by an infected. Nobody know the B infected people, including the Bs themselves. If the D who are quarantined, who are at home, they go out, they accidentally might cross people B who are already infected, but we do not know. In that manner, D category people can also be affected. In that manner, B and B2, the two categories of people who will be infected. It's difficult to find Group B people already. Group D people are also at risk because they may be infected by Group B. Now, if the D stays quarantined at home, the group B people who were accidentally quarantined in 14 days' time will show symptoms, and it will be easier to find out who this section of group B people are who were accidentally, unknowingly infected by the virus. So we now understand the significance of group D, and most of us lie in group D section who are at home trying to safeguard our own safety, our own health, and also making sure that others around us are also not infected. So this breaking of the chain of transmission infection is very important, and that was the message from this illustration. Now here are also some physical activities that one can do at home during COVID-19 outbreak. WHO has shared some tips, and these are walk up and down the stairs, regularly check your sitting posture also while working from home. Remember to break up your sitting and standing postures while working on phone or watching TV, considering that you'll be in lockdown. Whether you're in India or outside, many countries have announced lockdowns, so making sure that your posture is correct. Remember to walk up and down the stairs at your house or societies. That will give you some exercise. Do some stretching exercises at home. You can dance, whether you're a good dancer or not. You can always try it out and make sure this can be a form of exercise and entertainment for you. Also seek more ideas and resources online. Stay engaged, keep boredom at bay, and make sure that you engage in creative activities at home. Now, these tips have come out by World Health Organizations, different things about postures and also getting some exercises at home. These are simple exercises that each of us can put to use while we're staying home. And we know that celebrities have also come forward to spread awareness about COVID-19. Today we bring you another input. Actress Trisha speak about the importance of cleanliness in this context.
Novel coronavirus or COVID-19 disease can be stopped. Together, we can do it. All we need to do is take basic precautions. Whenever you cough or sneeze, always cover your mouth with a handkerchief or tissue. Throw the used tissues into a closed dustbin immediately. Don't touch your eyes, nose, and mouth unnecessarily. Wash your hands with soap more frequently and for at least 20 seconds. Avoid participating in large gatherings. If you have a cough, fever, or difficulty in breathing, avoid close contact with anyone. Visit the nearest health facility or your doctor immediately if you have symptoms. Cover your mouth and nose using a mask or cloth at this time. For more information, contact the Ministry of Health and Family Welfare's 24/7 helpline number 011-239-78046. Help us to help you.
And as we conclude this special presentation, just a gentle reminder, stay at home, stay safe. All of us are together in fighting against COVID-19. Namaskar.